Good morning, everyone. I'm Muriel Bowser. I'm the Mayor of Washington, D.C. I'm joined today by members of the D.C. Public Education team. We are located in the Marion Barry building, and we're providing a COVID-19 update. And specifically today, we will be talking about back to school. So let me acknowledge Deputy Mayor Paul Kine, State Superintendent Christina Grant, Chancellor Louis Farabee, and Dr. LaQuandra Nesbitt. And you will be hearing from them throughout the presentation and questions. So this is a relatively long update, and you will hear from several speakers. And we are trying to lay out very clearly all of the information that families need to know in the weeks ahead as children return to school. First, and as everyone knows, that working together, and it's going to take the entire community to make this school year successful. We have prepared a robust series of layered protocols that we have developed over the course of the year as we have brought children and staff safely back to schools. We know that we can successfully reunite our students with their teachers, classmates, coaches, counselors, and mentors and friends. And we expect that throughout the school year, a range of health and safety protocols will be activated. And that will mean that our systems to protect our students and educators are working. I want to remind everybody that we're now going into another school year that has been impacted by COVID. And over the last year, we've had experience not only in our schools, but in other parts of our government with in-person programming. Last year, approximately 15,000 students experienced some learning at DCPS. Over the course of this summer, 12,000 DC Public School students participated in in-person summer programming, and over 5,700 young people participated in in-person programming at the Department of Parks and Recreation. And more than that, more than 5,400 of our students participated in in-person activities for the Marion Barry Summer Youth Program. So we know that we have put in place the types of layered protections that will keep our children safe. And so now we have been very focused for many, many months on how to expand that work. While it is a big lift, it's a necessary one, not a simple task, but one that our families and our community are depending on so that we can get some semblance of normalcy back to our lives. So with that, we know how important it is as well for the children and their development, and I know Chancellor Farabee will talk a lot about that. About all of our activities starting with this summer and throughout the next several years about how to accelerate learning. So anything lost in the last year will be recovered by our students. I want to turn now to Superintendent Grant, who is going to go over some information. As you know, Dr. Grant joined our administration in the last couple of months as the leader of OSSI, and she will talk about guidance protocols that apply to all of our sectors in public education. Dr. Nesbitt will have some words, and then we'll hear from Chancellor Farabee. Dr. Grant.
Thank you, Mayor Bowser. Again, Christina Grant from OSSI. As the District of Columbia's state education agency, we are working in partnership with all of our schools and related systems to ensure strong school reopening. As we continue to respond as a district to the COVID-19 pandemic, this also includes ensuring that our students are able to return in person for in-person instruction during the 2021-2022 school year. We continue to support our schools in operationalizing the guidance issued by DC Health. This morning, I want to briefly give you an overview of district-wide practices that will be critical to protecting the health and safety of all our children in all our schools. Testing for COVID-19 can provide an additional layer of protection, along with COVID-19 vaccination, masking, physical distancing, and other strategies to support health and the safety of our school communities. Schools have options to implement COVID-19 testing programs in the coming school year. They can participate in the OSSI-managed centralized testing process, supporting a saliva-based test, or they can receive a sub-grant to develop their own programs. I wanted to quickly show you all the tests that students will be utilizing a part of the OSSI-sponsored program. Fairly simple. Students will receive a vial and a funnel. They will unscrew the vial, insert the funnel, they will use it, and then they will close it up and send it for testing. Non-invasive and very user-friendly. When we think about the actual testing protocol, DCPS and participating charter schools will strive to test a representative sample of at least 10% of students. All unvaccinated staff participating in schools will be eligible to be tested weekly. Symptomatic testing will be available to all students and staff who have provided consent. Results will be made available to families and staff through a secure portal in an average of 6 to 8 hours. Because testing for COVID-19 is a medical procedure, parents and guardians must consent for their children to take these tests. OSSI has provided a form for all LEAs within our centralized program for usage. LEAs are including these forms in paperwork needed for the start of school. The consent form is also available on OSSI's website. With respect to quarantine, DC Health has issued health and safety guidance for all schools in the District of Columbia. When there is a positive case in a school, schools will follow the DC Health guidance for quarantine. More broadly, students and staff should not attend school and should isolate if they are confirmed to have COVID-19. These individuals should not attend school and should isolate for 10 days and show improvement of symptoms, including no fever, for 24 hours. Unvaccinated students and staff must self-quarantine and not attend school for at least 7 days if they are a close contact of another individual in the school who tests positive for COVID-19. Students and staff may return to the classroom after 7 days if they take a COVID-19 test on or after day 5 and receive a negative result. If no testing is done, the person must self-quarantine and not attend school for at least 10 days. However, fully vaccinated students and staff who have been in close contact of an individual who is positive for COVID-19 do not need to self-quarantine as long as they are asymptomatic. They are recommended to take a test 3 to 5 days after their exposure to the positive individual. In the most recent guidance for schools, the Center for Disease Control and Prevention and DC Health articulated an important exception for students in the K through 12 classroom setting. A student is not considered a close contact if they have been within 3 to 6 feet of a fellow infected student, as long as they were both wearing well-fitting masks and other mitigation strategies are in place. Again, OSSI is working diligently to support schools in partnership with DC Health in their planning to support schools returning to school. With that, I will now turn to Dr. Nesbitt from DC Health to provide information on general guidance.
Thank you, Superintendent Grant. We know that it's important that we not only have our students return for in-person learning, but once schools reopen and students return in person, we're able to keep our schools operational. One of the factors that will contribute to our success in being able to do that is having everyone stay home if you're sick. It's been an important message for us throughout the pandemic and in general, and we want to continue that. Parents will be able to self-screen their children on a daily basis to determine if they are sick and should stay home from school. If they have one of the red flag symptoms, shortness of breath, worsening cough, or loss of taste or smell, they should stay home. If they have two of the symptoms that are often seen in COVID but can be indicative of other illnesses, they should stay home. And that list includes things such as fever, chills, diarrhea, runny nose, or congestion. A parent should also remain in touch with their healthcare provider if their child has a chronic health condition to be able to ascertain whether or not the symptoms that the child is experiencing is related to their chronic health condition or are possible signs and symptoms of COVID-19. In addition to getting back to school, we want to have an opportunity for our students to be engaged in their extracurricular activities, including sports. It's important for us to continue the layered mitigation strategies for our student athletes, and as such, all participants of sports should wear a mask at all times when possible, and with the exception of when they are actively playing on the field, and they should remain socially distant or physically distant when at all possible. We are clear here to highlight which sports have the higher risk, which sports have the lower risk, to allow parents, school officials, athletic associations to be able to make priorities around the types of activities that students should engage in when there is high and substantial transmission in our community. In terms of travel, it's been a busy summer. We've all seen all of the data from TSA, and we've seen all of the reports and the imagery of people traveling. However, our travel guidance has remained consistent that unvaccinated persons should refrain from non-essential travel when at all possible to reduce the risk of transmission of COVID-19. Our travel guidance currently states that any unvaccinated person who travels outside of the DC, Maryland, Virginia area is recommended to quarantine upon their return. And this also suggests that they should have a test in that 3 to 5 time period after they return. For students who are traveling and are unvaccinated, we expect that they will follow this recommendation. We know that missing school in person because of travel can be extremely disruptive to a child's learning and educational experience, and we encourage all of our families to consider the types of activities they participate in as a means to keep their unvaccinated family members safe. And now I'll turn it to Chancellor Farabee.
Thank you, Dr. Nesbitt. DC Public Schools will be implementing a layered mitigation approach to preventing the spread of COVID-19 in our schools, and there are 3 key pillars to this strategy. One is to prevent. DCPS is focused on preventing the spread of COVID-19 through universal masking, physical distancing, enhanced air filtration, cleaning, and robust campaign for the community around the COVID-19 vaccine, alongside a requirement for staff to be vaccinated. As relates to screening, DCPS will continue our COVID-19 symptom screening. We're asking that students and family complete an assessment daily along with staff, and then we will have regular asymptomatic testing for unvaccinated students. In addition to that, we will keep families informed of any positive COVID cases within their school or within their classroom. As we go to the next slide, as I mentioned earlier, part of our prevention strategy is to ensure that we have universal masking. What that means is that all staff members, students, and all visitors will be required to wear a face mask when they're on school grounds. This is consistent with the DC Health latest guidance and also consistent with the CDC guidance as well. Masks can be removed for eating, when students are actively eating or drinking or doing naps for our pre-K students. And these are the only time period at which students can remove their masks, for staff as well. So go to the next slide. We're reminding all of our families that we're still expecting students to have a complete pediatric immunization record. What that means is students have until the 20th day of school to have that completed. We're also offering opportunities for students to get appointment at DCPS campuses to get their childhood immunizations. Families can go to Vaccinate.dc.gov to make an appointment. We have over 2,000 appointments available to families. Families will have the ability to make these appointments into September, but it's important that as many of our students as possible receive all of their shots for their pediatric immunizations before the school year begins. Another prevention strategy is our physical distancing and student interaction. We will have all of our classrooms spread apart where students are as physically distant as possible, and to the extent possible, students and adults will be 6 feet apart. We're also limiting cohort interactions to ensure that we mitigate any spread among students in various cohorts. And then we're also encouraging all of our schools to maximize the use of their outdoor facilities as well when possible. For lunchtime, all of our early childhood education students in pre-K 3 and pre-K 4 will be eating in their classroom, which is consistent with our practices in the past. Students in grades 1 through 12 may eat in the cafeteria or they may eat outside. When feasible, we are encouraging all of our schools to utilize outdoor spaces for eating. Cafeterias will be set up to have social distance spaces, and in addition to social distance spaces, there will be assigned seating for students. In addition to that, we have 2 large HEPA filters in all of our cafeteria spaces to ensure that our air is clean to mitigate any spread of COVID-19 in the cafeteria. As relates to visitors, we will continue to limit the number of visitors on our campuses. Visitors must have a pre-approved visitation with administration at the school to be on campus. We're also asking that all individuals that come on campus have a completed health assessment and will be asked our protocols of this assessment when they enter the building and will be required to wear a face mask while they're on the grounds at all times. As relates to arrival and dismissal, we're reminding families that families are not allowed to enter the building for student drop-off and pickup, except for when a parent or guardian needs to escort a student into the building as part of a written safety plan. We're also reminding families that we are continue our air filtration and cleaning protocols in alignment with our CDC guidance and DC Health guidance. You'll be reminded that we invested over $20 million in HVAC upgrades that will continue to be implemented this school year, and each classroom and common space will also have a HEPA filter as well. All of our cleaning supplies are also in alignment with CDC guidance. So we think about screening, we are asking families to ensure that they screen their young people before they come to school. We implemented last year a ask, look protocol where we're asking families to ask young people the following questions, and we're also asking families to look for any symptoms of COVID-19 as described by Dr. Nesbitt earlier. We will also have our asymptomatic testing protocol in place for our unvaccinated students. We will be testing 10% of those students randomly each week in our COVID-19 testing protocols that were displayed today by Superintendent Grant. We're asking families to please complete the consent form for testing to ensure that we are testing as many students as possible. Again, this will be for unvaccinated students who will receive the weekly asymptomatic COVID-19 test. As we think about our next steps, we also want to remind families that you will be informed anytime there is a COVID-19 case within a school. Families will receive notification if anyone tests positive in their classroom or in the school. Families will not be informed of individuals that have tested positive, but they will also be informed if their student needs to quarantine as a result of a positive COVID case in the school or on a campus. We are continuing to follow our quarantine protocols in alignment with DC Health and CDC guidance. If a teacher is unable to perform their duties in person due to the need to quarantine, we will first identify a substitute to serve the students that are in person. If the teacher is well, he or she may teach students virtually, or the students may also have an opportunity to have access to simulcast instruction where students are taught by a teacher both in person and at home. The magnitude in which that will be applied will be determined based on the scope of the number of students or staff members needing to quarantine. Schools will share detailed information on those steps with families. We also are proud to report that we will be providing devices to all students in grades 3 to 12 with a 1-to-1 ratio. What's exciting about this is this provides us the opportunity to ensure that a student can take their device home when they need to learn remotely and also complete assignments at home as well. Students will also have access to devices that are equipped with Wi-Fi access, so students can access the internet at home if they don't have internet at home. And then for our students in our lower grades, they will have the device ratio of 3-to-1, and again, those students can also take those devices home as needed. As we go forward this school year, we want to remind families that as students need to quarantine, there are very specific attendance policies associated with quarantining. Families that are in quarantine or students in quarantine as a result of activities outside of DCPS operations, those family members or students will need to produce documentation so we can provide a excused absence for those students. Any student that is quarantining or absent due to a DCPS related quarantine do not need to provide any documentation, as that will be provided for the student. To think about next steps, again, we want to remind everyone, as the mayor said, we're all in this together. We all have a role to play as it relates to our individual and collective responsibility to ensure that we continue operations of our schools. So we think about next steps. We are encouraging all of our families to ensure that any student that's unvaccinated, that they complete the testing consent form, and we have that on file for them. All of our students have their complete immunizations before the start of school or by the 20th day of school. And then we want all of our students 12 years of age and older to ensure they get the COVID-19 vaccine. We're also asking families to be mindful that every day still does count. We're excited to have all of our students back on campus on August the 30th, full-time in person, but we want our students to be present every day. We also are reminding our families of schools that are in select neighborhoods that they will have access to shuttles that we're launching this school year. We have 24 new school shuttle routes that will be launching in Ward 7 and Ward 8. And schools will share that information directly with families on how to access these transportation options. We will again be asking everyone to join us in this effort to ensure that we continue successful operations of our school. And what that means for our families is we're asking you to take a pledge. To take a pledge to build back a school year that's stronger than before. And to do that, we're asking all of our families to ensure that you are compliant with our masking. We also want to ensure everyone that's eligible to receive the COVID-19 vaccine is doing so. And we want families to limit travel, skip travel when possible. We know that this is important to ensure that our students are back in school and they're safe. And then we also want families to be smart about risky activities outside of the school day. And most importantly, if a student is not well or they're sick, make sure that they stay home. This Saturday, we will have a back-to-school opportunity for families to get access to incentives in the COVID-19 vaccine. But on August the 28th, we're excited to partner with the mayor on a community celebration at Banneker High School, where again, students and families will be preparing for the start of the school year. Reminding that we have sites across the city, 3 of our middle schools specifically are sites in which families can get access to incentives for the adults and students, and that's at Brooklyn Middle School, Sousa Middle School, and Johnson Middle School. Thank you.
Thank you, Chancellor, and I want to thank the whole team, and we can answer your questions. Yes. Yes, Perry.
Yeah, thank you. To start with, I have two questions, one for Dr. Farabee and one for Dr. Grant. Dr. Farabee, why, if a child is quarantined, does it not go automatically to simulcast learning? Did you sign anything? Are there any considerations with the union that are preventing you from saying automatically a kid goes to quarantine, they'll be able to participate in the class from home?
Yeah, thank you, Perry, for that question. So we have a verbal agreement with the Washington Teachers Union on our memorandum of agreement for this current school year. It does not speak directly to when we enter into our protocols for simulcast instruction. One of the considerations as relates to when we would activate that option is knowing that it is a compromised experience for some students. And we also know that there's time needed to plan for execution as well. And so we don't want to be in scenarios where we are entering in simulcast instruction for 1 or 2 students out of 25 or 30. We want to be really careful when we would utilize that option.
Got it, thank you. And Dr. Grant, back to testing. Now that you have more details, I do want to ask, is there a reason why the strategy hasn't changed, that if a school has a smaller amount of consent forms, you would do a larger pool? I mean, am I thinking about this right, where I think that if you have a school with a smaller number of consent forms, you will be testing a smaller percentage of that student body? So perhaps schools in neighborhoods with higher infection rates may actually get lower testing if they have a small number of consent forms?
That's a good question, thank you. The current focus now is encouraging our families to sign the consent forms so that we can achieve the testing metrics that we've set forth. We will reflect as we move forward on if that posture has changed. But right now, we are strongly encouraging families to sign the consent form so that we can meet the objectives of making sure we're able to have testing across all of our schools.
And I guess, why can't you just commit to testing 10% of a student body automatically?
Without consent? Is that your question?
No, assuming at least 10% of people consent.
What is the
I don't
number?
understand.
What is
Yeah,
I think we're saying the same thing.
Good. If 30, right, I guess you could test a bigger pool of the consent, right?
We have to have consent from families. And so the focus now is working directly with DCPS and other individuals who are using our centralized program to gain consent from families. For families, it's critically important. It is going to help us achieve the goals of making sure we are able to test students weekly, targeting unvaccinated students. That is the posture that we're in at this present moment.
And if you have a school with a small number of consent forms, are you guys thinking of different strategies for that school?
Well, the strategy would be to get more people to consent.
Right.
I mean, if you're asking, are we going to force test kids, is that your question, without their parents' consent?
No, that is not my question.
Okay, I guess I'm not following you. It sounds like what you're saying is if you have a low number of consent forms, you don't have enough kids to know what's happening at the school.
Exactly.
So therefore, we have to get more consent forms and make sure that we're getting them signed, and making sure also that all the children who are eligible to be vaccinated are vaccinated. Any other questions? Yes, Mark.
Just a couple of clarifications. Does this take to charter schools or private schools, or is it just traditional DC public schools?
What's that?
The protocols that you're laying out here today.
This is for DC public schools.
Okay.
And Dr. Grant's comments apply to public charter schools.
To public charters as well. So the testing protocol, the mask protocol, the distancing protocol, that would be charter schools as well.
Let me be clear. So all mask in all schools is your first. Social distance protocols for all of our schools. For testing, charters can opt in to be a part of the centralized process that is being set up by OSSI. Some charters also have set up their own testing protocols, but testing protocols must exist in all schools.
Okay, I appreciate it. And then just to clarify the difference between this document that we were handed and the PowerPoint, the one thing that I see, Dr. Farabee, you said that they would be students and staff would wear masks outdoors as well as indoors. On this document, it's different, it's worded differently, that only unvaccinated in very crowded conditions would mask outdoors. So can you just clarify that for us?
Yeah, we had a policy last year and over the summer to ensure that everyone was masked, whether they were outdoors or inside. We believe that that was effective for us, so we believe that that is the standard that we should apply for this coming school year. We also think it is difficult to monitor when it's crowded or not crowded, and also determining who's vaccinated and who's not. So we believe to be consistent across the board, if you go to a playground or school, it's typically going to be students in the space that are going to be close to each other. So we believe that the best place to be is to have all of our students masked when they're outside, and that's our posture right now.
Thank you. And then Mayor Bowser, if I could ask you, with as much respect and courtesy to your daughter, what are your concerns as a parent of a school-age child going into school this coming year? What can you say, not as the mayor, but as a parent going through, and kind of what you're going through right now that so many other parents are going through as well?
Well, I don't think that we're any different than anybody else. Let me say that. And I'm pausing because I'm not going to talk about us, in particular. But I think that I'm going to be asking the same questions that every parent is asking. I am fortunate in that I know everything that DC Public Schools is doing, and I know everything that our state office of education is doing to keep children safe. But I also go into this, and you won't be surprised, that knowing that kids have got to get back to school. The amount of what they don't benefit from being in our wonderful buildings around professionals who know how to teach kids is substantial. And if we have to be committed as a community that return to school is our #1 priority. And that is what we have laid out over many, many months of work. Yes.
Chancellor Farabee, you said that the school system and the WTU have a verbal agreement over an MOA. Why hasn't an agreement been signed, and what are the last sticking points?
Thank you for that question. So according to President Pogue Lyons, their attorney was out of the office on Monday, and I believe is returned on Tuesday, and there was a need to have their attorney review what we agreed to over the weekend. I want to give a special shout out to their team, though. Their bargaining team and our team met throughout the weekend on Saturday and Sunday to get to where we are today. And I'm confident that we are in a strong position to execute on the agreement that we achieved over the weekend.
And there have been some families who have pushed over the last couple of weeks for a virtual option. That's obviously something that you guys haven't touched on, but is that something that DCPS was considering, broadening out the virtual option to more students?
It is not something that we're considering. We have about 150 families have expressed interest in the medical exemption. Of those, we had about 98 that have been approved. So we don't see significant numbers there, and we believe firmly the best place, the most ideal place for our students is in the classroom. There are so many benefits academically, socially, and emotionally that we can't wait to get back to. We look forward to welcoming our students back on the campus on August 30th.
Yes.
Yeah, following nationwide trends, is DCPS or the charters, are you guys expecting a bigger kindergarten class or pre-K4 class? And if so, how do you plan to accommodate that?
So we're excited. We're opening a new campus. So as you may know, we have our Military Road campus that's open this year. We anticipate our pre-K numbers to be back to where they were prior to the health emergency. I know families had to make some tough decisions during the health emergency. We were in a remote posture about pre-K3 and pre-K4. We're thrilled to have them back on campus, and we're thrilled to open our second dedicated campus for 3-year-olds and 4-year-olds come August 30th.
But are you seeing kids kind of, because of the virtual year, which we know is hard, especially for young families, repeating kindergarten?
So we haven't seen lots of repeats or calls for retention. What we do see is families who may have decided to utilize a daycare facility or another adult to supervise their children, and in the previous status that we were in, looking forward to bringing their student back into the fold for the fall full-time in person.
And a clarification on health guidance. I know, Dr. Nesbitt, the health guidance says it is now recommended to quarantine after travel, as opposed to it used to be required. I've heard from some DCPS parents that they've received notice from principals that they are, in fact, going to be required to quarantine after travel. Is DCPS adopting DC Health's policy on this?
Yes, DCPS is adopting the guidance from DC Health, and we've communicated that to our principals.
Okay, so,
Yes.
Off topic.
Yep.
For Dr. Nesbitt, 2 questions for you. Could you tell us what the protocol in the district will be for booster shots once they become available and that becomes standard? And I'm also wondering if you have any comments on the resignation of Dr. Gales in Montgomery County.
Sure. So just as every other jurisdiction, we are watching very carefully and monitoring very carefully and in communication with our partners at the CDC regarding the plan for a booster dose for people who have completed their primary series of their first 2 doses of an mRNA vaccine, which is expected to begin in the fall. Our plans will become more concrete as we understand more about the timeline, around more about the processes. Some of the things currently under consideration is reestablishing the long-term care partnership that had pharmacists, parts of large pharmacies going into our skilled nursing facilities and assisted living residences to provide them access to vaccines. So to ensure that some of our most vulnerable residents living in congregate settings get access to booster doses as soon as they are approved by the FDA and recommended by the CDC's Advisory Committee on Immunization Practices, which has not happened heretofore. For members of the general public, we'll hearken back to December, where supply was low and demand was high. And we had specific locations where people were able to go and receive a vaccine. Many of those were in our larger healthcare systems. Today, we're in a totally different environment where supply is sufficient to meet demand and in many cases exceed demand. We have a number of locations, over 100 locations, standing locations throughout the district where people can receive their COVID-19 vaccines. All 3 of the approved vaccines are available in community settings. And this is in part due to more that we've learned about the vaccines and their shelf life, the ability to have them in refrigerators instead of the deep freezers. All of that has been part of our critical learning over the past several months. So we will continue to monitor the situation. I think you know, Mark, that I am one of the first people to have gotten vaccinated, so you'll hear from me when it's time for me to get a booster, if there is a time frame put to it. As for my dear buddy Travis Gales from Montgomery County, I do think that it is a huge loss for us. I've known Travis for several years. He used to be a member of our team at DC Health, serving as the Chief Medical Officer for our HIV/AIDS administration. So you can imagine that having him as a former team member and now as a colleague and a peer working through COG's Health Officials Committee, we've worked very closely together over the last several months. We've even served as co-chairs for COG's Health Official Committee. I'm excited for what the future holds for Mr. Gales or Dr. Gales, just as I am for any of my colleagues who are transitioning during this time, and I'm confident in the talent that we have in the region to ensure that all of our counties in the National Capital Region can continue to have a robust COVID-19 response.
Thank you.
Okay, one last round. Yes, ma'am.
yeah, bouncing off Debbie's question, are there any metrics that you guys are looking at that would trigger a reconsideration of an all-in-person posture? Meaning, if cases get to this amount, or if infection, would you consider more virtual offerings than you currently have?
Let me just say, Perry, we stated from the outset that for our city, having in-person learning is a top priority. And that's how we continue to approach our response to COVID, including having a masking requirement for indoor settings, not just schools, but for indoor settings. And we continue to ask school communities to step up and do it even more to keep their school community safe, so that we will be in person. Dr. Farabee has already laid out what our protocols will be in schools and when classrooms are affected, or if more than one classroom is infected as well. So we don't have a metric that says we're going to shut down schools.
Thank you.
Yes.
I mean, it seems reasonable to assume that there will be cases inside schools. I'm curious, like, what could parents reasonably expect in terms of cases, and sort of what is the school system preparing for? Like, how will you know if there are more coronavirus cases than one could expect versus what might just be expected given that students are going back?
You're right to say, and I think if Dr. Nesbitt didn't say it, she usually says it, is that we see more activity. We see kids being involved in more things, and we saw it from summer travel to summer camp, and we see it in other parts of the country that have started school earlier, and we also will see it here. That is correct. We will see more cases, but we don't anticipate that those cases will be more than what we see in the general population. And so and we will continue to report that. What I can tell parents unequivocally is that in Dr. Nesbitt's daily review of cases and trends, if there is a trend of concern that requires our action, we'll let you know about that trend, and we'll take any action necessary.
Mayor, if I could add.
Yes, please.
We also don't need to be entirely speculative about that question, because we currently have thousands of public school children in school buildings currently in DC. Many of our charter LEAs have opened early. They started last week. And we are seeing some positive cases among students and children in those schools. And what we are seeing is that their safety protocols are being followed, and they are working. There are students on quarantine, there are teachers on quarantine, and the school days continue, and in-person continues to occur in those schools. So I do think that the layered mitigation strategies are in place and do appear to be effective currently amongst our schools that are operating.
Okay, thank you, everybody.